Dark circles. You buy lots of concealer? Let's talk about it. So this is going to be labeled as my Fresh Face series. I've talked about how lazy I can be in my skincare routine video. So this is just a piggyback off of that. But do you have problems with dark circles underneath your eyes? And maybe even some crepey skin? And so you pile on the concealer and it works. It works really well. But would you like to not have to pile on pounds of concealer just to be able to feel comfortable walking around? Well, what causes dark circles? The cause can be a variety of reasons. The most common ones are fatigue, which many of us are, trauma just from rubbing your eyes, and aging. Getting older is bitch. But how do those things translate into dark circles and why? So the truth is that the eyelid skin is the thinnest skin that we have in our body. And so when you see dark circles underneath your eyes or around your eyes, what you're seeing is thin skin, and underneath that, the reflection of capillaries through the skin. Well, if that's true, then how is it really possible? Can we actually get rid of dark circles effectively without just concealing them with concealer? And the answer is hopefully yes. So I don't have any makeup on, I have no concealer on, and I do like the way that my under eyes look with concealer, but I also realize that I have pretty good eyelid skin. So what do? So the first step, and this really is the first step, it's the cheapest step, the least invasive step, it's the first step even if you're gonna go beyond this. The first step is to use a retinol-based eye cream. I would start low and slow. Retinol can be irritating to the skin, and it's also important to note that retinol can make you more sensitive to the sun. So definitely pair this with a sunscreen as well. I would start at night and start every other night and just see how your skin does and how your eyelids do with this before maybe progressing to every night. Retinol helps to increase cell proliferation. It helps to build collagen, and it basically helps to resurface the skin. The next step would be laser or microneedling, external laser beam or microneedling. These have the same principles. They're creating tiny organized damage in the skin to, again, get collagen stimulation, cell proliferation in an organized fashion. The result of that is skin resurfacing, skin that's resurfaced and looks younger and healthier. Another step would be adding radiofrequency to this. Now, how is that different from laser? In a way, it's not, but the mechanism of delivery is a little bit different. So you can combine microneedling with radiofrequency, and you have Morpheus, which I use in my office and I love. But you can also use an internal radiofrequency, and that actually most effectively helps to build collagen and tighten skin and resurface skin. Now you can combine internal radiofrequency with external laser or radiofrequency with microneedling, and you truly get the most effective way to tighten the skin, resurface the skin, and get rid of those dark circles. Now, another adjunct that I also love for patients is to kind of create a protective layer in between the skin and the capillaries or the blood vessels. How do I do this? Well, fat grafting. So if I take some fat from anywhere in the body and process it into what we call nanofat, it's the kind of most microscopic fat particle we can use, and inject that just underneath the skin. What it does is it helps provide stem cells that'll help, again, resurface the skin. It also adds volume, so if you have any hollowing of your lower eyelid skin as well, you can add volume. And again, it creates another layer between the skin and the blood vessels below. Any combination of these practices really does effectively treat dark circles under your eyelids. Talk to your plastic surgeon about what the plan might be for you. What will you try from this list? Leave your comments and questions below. As always, love you lots, and bye for now.